When I brought up the burn pits to the oncologist, he said, there's no way that caused it. I'm not going to write a letter for you. I was like, whoa. So I went to the VA and they said, what you were exposed to is much worse than Agent Orange.
Waiting for a breast biopsy result, Laura Pearson found herself staring at a motivational poster. The difference between an ordeal and an adventure is a positive attitude. So this Iraq War veteran made a decision that transformed her entire life. She chose adventure. And for Iraq, cancer isn't just a medical diagnosis. It's actually connected to their service, to toxic burn pits that created a sooty haze over their bases, leading to a 20 to 40% higher risk that the VA has finally acknowledged. It's my honor to have Laura on the podcast. Welcome to Kicking Cancer's Ass.
Thanks for having me.
You're welcome. Laura, you were low risk. You had every clinical indicator saying you're low risk. And you felt a lump. And tell us the story, because I think you really pushed for your OB-GYN to explore something that she or he was trying to dismiss.
I did. So I found a lump myself. My mammograms had been clear. I'd gotten a mammogram every year. And I had dense breasts, so they would always do an ultrasound in addition, but they did say that it was clear each time. So I did find a lump completely by chance, if I'm being honest. I wasn't, I think because I did the mammograms, I excused myself from the self exams, but by chance I happened to feel a lump and went into my OBGYN. She felt it, said that, I have dense breasts, probably just cystic, and that she wasn't concerned that it was cancer. So that's fine. I was concerned that it was cancer. So I pointed out that I would have a mammogram, and I think it was due in like 3 or 4 months. And so I said, why don't we just put me in for a bilateral diagnostic? I can knock out the mammogram that I have due for my annual, and then I can be confident that it is just cystic.
She agreed to that?
She did. Yeah, she did. I went in for another appointment after that because I had a regularly scheduled well woman appointment, and again she said that it probably wasn't cancer and that she wasn't concerned. I think that since I was low risk, relatively young for the diagnosis, she was trying to assure me, but I didn't want the assurance. I wanted the tests.
Yeah, the proof, right? All the way to, they actually had to do a biopsy for you as well, right?
That's right. Yeah.
Yeah. How did you know to ask for a bilateral diagnostic mammogram as opposed to a standard screening one?
AI is the future, right? And so I consulted. I understood that sometimes you go into a doctor and you don't have the conversation you want to have, or they may not take it seriously. I've had that happen many times. So normally I would do a little bit of research about what the normal protocols are, so that I could make sure that I'm getting a normal standard of care. But in this case, I went to Gemini and asked what would be the standard test for this, or what should I ask for if I am concerned? Because the lump, it didn't feel like anything that I've ever felt before. And I talked to a breast cancer survivor before and asked her, how would I know? And she's like, oh, you'll know. And when I felt this, she was right. I knew. And so I wasn't going to drop it. If this doctor hadn't followed up, I would have just gone to another one.
Smart. My sister's first diagnosis, the doctor said, I'm sure it's nothing, just leave it. And when it didn't go away 30 days later, she said, I would like nothing removed. And this was in 2003, but she's like, remove it.
Yeah, a surprising number of women have that experience, unfortunately.
Well, and I think it's important for women to know it's okay to advocate. It's not an insult to your doctor. And statistically,
Right.
Your doctor's right. Right? Even if you see a lump and they do a biopsy, statistically, it's not likely to be breast cancer.
Yes. I understood her rationale and the logic, and I understand why, it was maybe like a sound professional judgment, but she has many patients, but I have one life. So I'm going to push for the best care.
I love that. Okay, so let's dig into you are part of I'll call it a unique sisterhood of veterans. And when we first started talking, you shared that there's a shockingly higher rate of cancer among veterans.
Right.
And it seems that a lot of medical professionals and even veterans themselves, they don't know. How did you discover the link between your service and your diagnosis? And what should veterans be asking their doctors? And what do healthcare providers need to know about screening veterans?
So I think that the topic of toxic burn pits has been in the press for a while, and I'm a person who keeps up with the news, and so I'd heard about it, and I was aware when they opened the National Burn Pit Registry. Initially, I thought, well, I'm healthy. Why would I ever put my name on this? But a colleague of mine urged me. He said, you really don't know how this is going to develop. You may want to put your name on it because you were absolutely exposed. So I did put my name on it at that time. And then more recently, there's been a bunch of changes related to what's called the PACT Act. And the PACT Act some legislation that made it so that Iraq and Afghanistan era veterans are covered for certain conditions that have been now proven to be linked to the exposures that we had during our service. I received a letter, I think after the PACT Act passed, that gave me kind of a laundry list of uh, a laundry list of conditions that I may have a heightened risk for, but it read a lot like, the when you read the fine print on a medicine or something like that.
Mm.
And so, I just kind of I read it, I tucked it away. I, didn't take any action on it. It said that women will be able to get free mammograms through the VA, and I believe it was not age restricted in the way that it is for normal civilian patients. But I didn't do anything with it at the time. So that said, when I got my cancer diagnosis, I was thinking about the fact that my risk scores were so low. My doctor was, she kept saying, "You're very healthy. I can't imagine that this is cancer." And so, of course, you think why, and I immediately thought, oh, I did get this letter. I was exposed to these things on a daily basis, so that's probably why.
It's interesting because I think almost every person I've talked to asks the question, why did I get cancer? A few of us, like I have a genetic mutation, so we more or less have an answer. You more or less have an answer.
Right.
There's a weird piece in having an answer. It still sucks and it's still annoying, but at least that question of was there something I could have done? I mean, you were deployed. You didn't have a choice. And I perhaps we as a government should have not had burn pits. But I'm not military. I don't know why one would do that, but I assume there were reasons.
Yeah. So yeah, I do have an answer, and I did the full like 92 test panel for genetics. I have no genetic risk. So it really does appear that this is it. A lot of people have different feelings about the decision to do burn pits, and I think all of those feelings are completely valid. I
Mm.
would say my personal opinion is, we went to war, and there were things that needed to be gotten rid of. And we invaded another country. We didn't have, relationships with the disposal places. Some of this I'm sure was military grade things that needed to be disposed of. And these people made decisions that they felt were best at the time. And I don't know what facts they were looking at, so I'm not actually terribly judgmental of the decision. They've stopped doing it. It's been banned. But I don't know what choices that they were facing when they made that decision. So I'm very forgiving about it, I guess.
I think that's probably somewhat liberating. When you're living with anger, you just get to be an
Hmm.
angry person, right? Like at the time, they weren't saying, let's go kill all of our veterans. They didn't know
Right.
that burn pits would cause this expanded circle of people facing cancer. And now, in spite of knowing that, and that
Mhm.
there are higher risks for all of these things that you got a letter for in the PACT Act, it does seem that female veterans fall through the cracks. Now, you told me you initially avoided the VA. And,
That's right.
tell me about that. And what should female veterans know about the VA?
So women in general have they're much less likely to use VA services, and this is a gut instinct that I had, but I looked it up, and the research bears it out that women just don't tend to use it, and I think when you're in the military and you're wearing a uniform, there's really no question about your affiliation. When you're a female veteran, there suddenly is a lot of questions about it because you're dealing with people who don't necessarily understand the military. So you tend to be challenged a lot on things. When I came back, people would say to me, "Well, at least you weren't on the front line," just kind of minimizing the service. Um, we haven't had a war with the front line since the Korean War.
Hmm.
So no, nobody's on the front line. And I certainly wasn't out conducting raids and things like that, but I was being mortared and rocketed and dealing with very much, like being in a combat zone and everything that comes along with that and the dangers
Hmm.
that come along with that. So, like a lot of women, I, kind of stopped talking about my military service just because I didn't want to have those interactions or, you park in sometimes at grocery stores they have, veteran parking. You park there. I've had people, I parked there once when I got out of the service, maybe like a year after I got out of the service, and this woman was like, just so you know, that is for veterans. And so you start to kind of build an identity that maybe doesn't highlight being a veteran the way that maybe a male veteran would, right? You don't wear the hat, you don't necessarily go to the services, use the services that are available. With the VA, you have this initial like a I think it's part of the out processing where you interact with the VA. And so I went into one and they were asking me who my sponsor was repeatedly. And a sponsor, generally speaking, you've got like the military member and then their dependents. And so the dependents will have to give the name of the sponsor. And I was saying, I don't have one. I am the service member. And he actually yelled at me. So I was like, okay, I'm kind of done with this.
Yeah.
That said, it was a while ago. It was a long, long time ago. And at the time there were not very many female vets. There weren't, and women have been veterans and they have been going to war for a very long time. So I'm not the first generation, but there just weren't as many, and there are a lot more now. And the VA has done a lot to improve and to address the needs of the female population. I have to say, like when I go to the VA now, it's night and day. They are absolutely wonderful. They're some of the best doctors and healthcare practitioners that I have ever dealt with. And I have excellent private health care, but on many things, I would rather deal with the VA because this the standard of care is just so much higher, which I would have never known if I hadn't gotten cancer.
So you were treated for cancer through the VA.
No, I was treated privately
Okay.
through yeah, so I took the surgical route and I was lucky I didn't have to get radiation or chemo. So it was, pretty much surgical. I had a breast surgeon through a local hospital system, and then I had an excellent plastic surgeon. And people told me the VA is good for a lot of things, but it's probably not great for plastic surgery, reconstructive surgery, things like that. So I wanted to, I'm
Sure.
young, I wanted to look good. So went with the best one. So after that though, because my cancer was caused by burn pits and the VA understood that, I started going to a VA oncologist.
Hmm.
So I initially went to a private oncologist affiliated with the same hospital as my breast surgeon. But when I brought up the burn pits to the oncologist, he said, there's no way that that caused it. I'm not going to write a letter for you. I was like, whoa, I'm not, first of all, I'm just asking you about this. I'm not asking you to write a letter. But second of all, I'm not the one saying this. Okay. Like the VA is saying this. Okay. And I would like to know, if I have an elevated risk for this cancer, should I be concerned about other cancers? Should I be getting screening for, for example, brain cancer? How Joe Biden often brings up his son that passed away from brain cancer. He was at the same base as me around the same time. Should I be worried about these things? And he said, well, listen, if it's not Agent Orange or radiation, you really don't need to worry. So I went to the VA, and I know. That's why I'm like, why are people beating up on VA doctors when private doctors are this way?
Well, and it's
So,
so dismissive. Like the number of things you served our country. When you served, you were in combat.
mhm.
Why are you being dismissed? I mean, it's infuriating. I'm mad for you.
I don't know. I assume it's not personal. I assume that, some you're going to have a bell curve of doctors like you have any other
Sure.
profession,
Sure.
you know. So I don't have time to psychoanalyze why he did that. But I did say to myself, okay, who will take me seriously is the VA. So I went, and I relayed the conversation in my first interaction with a VA doctor, and they said, what you were exposed to was much worse than Agent
God.
Orange. Yeah, and they were like, it's good thing you're here. So that kind of raised my confidence level that they actually understood what I what my risks might be as a result of my service. So I started going to the VA for oncology.
Now, you said you went the surgical route. Did you do a lumpectomy or bilateral mastectomy or a unilateral mastectomy? What surgical route did you
Bilateral
choose?
mastectomy.
Okay.
The
So,
mastectomy, yeah.
yeah, so I did too. I did the deep reconstruction. I don't know which reconstruction you did, but I hope you're happy.
Yeah, I am happy. I went with the implants, and that was a good decision for me. Yeah, they said they wouldn't be able to make much progress with the deep with me because I run a lot, so I just don't have much to work with.
And I had
Yeah,
plenty to use. So, all
it works
good.
out.
So,
Yeah,
in terms of being at the VA with the oncologist and having been exposed to this toxic mix of chemicals, are they
yeah.
do you get additional screening or higher levels of screening or screening for other body parts that not that civilians, people who are not veterans, just doesn't make any statistical sense to do?
So, because, I have some basis of comparison with what it's like to interact with a normal private doctor and then what it's like to interact with a VA. They're much more on top of like blood tests, for example. They test me much more frequently than the civilian oncologist was. They want to see me more often. And then more recently, my most recent appointment with the VA, when I went there, met with the doctor, and then um, I went up to the blood test area for them to do the blood draw, and they were closed for lunch or something. I don't know. They were closed. So I told my doctor, I'm gonna hit up the clinic that's closer to my house when I get time, so I don't have to wait through lunch. Um, and I got busy, life happens, and I didn't. And she called, and I was like, okay, I'm going to do it. And then she called again. This is something you would never get
No, it's
from,
amazing.
yeah,
It's
yeah,
amazing
it is. And then
the
then
follow
I felt
through.
bad. I was like, yeah, I felt bad. She had to babysit me a little bit, but I went and got my test. Yeah,
So I want to roll it back a sec. And I assume the tests so far have all been great
yeah,
and
everything's good.
wonderful. So you mentioned you were in the same place as Joe Biden's son. It's a hot spot. I don't
Mhm.
think many of us understand what you were exposed to. Can you paint us a picture of what life looked like on the base, the air quality, activities, how long you were exposed?
So I think the most honest answer is that I don't really know what I
Okay.
was exposed to. They haven't said what it is. I've read that, so I'm certain it was the trash that we were producing. I've read that it may have also been Saddam Hussein's chemical weapons, and that burning weapons is consistent with what they're finding in the lungs of veterans that were at that base. So they've done autopsies and taken lung samples and found titanium in the lungs. So that's consistent with, many things, but burning
Weapons.
military weapons would be one of them. So I don't know what I was exposed to. The base itself, if you're gonna deploy to a war zone, this is the kind of base you want to be at. Okay, it's actually physically beautiful. It was situated around a lake, and there was palaces and beautiful structures all around it. If you think about an Iraqi palace, you're probably thinking of the one on this base
Okay.
called Afal Palace. It's called the Afal Palace. Sometimes you see pictures of people sitting on Saddam's throne. That's at that palace. So it's a very famous uh, palace that was in the news a lot. I mean, it was not a terrible place to be stationed, but they were burning a lot. So it was pretty much constant.
Mm.
It was like this black smoke. And one of my friends who was older than me warned me, you shouldn't go out when you see this smoke. But I was young, and I love to run.
Mhm.
And so I would go running, sometimes running in it.
Ugh.
I would have to you have to walk from where you're living to work. So you're walking through it, there and back. When you walk to the chow hall, you're walking through it. If you need to run an errand, you're walking through it. So it was pretty much all the time during that time. Now, they banned it, I think, a couple years after I left, and I was there right after the invasion, so it was early in the war. But a few years later, they banned it. So I was one of the lucky ones, I guess.
How many years later was the onset of your cancer?
It's quite a bit later. Um, about almost 20 years later.
Almost 20 years, yeah. But they
Mhm.
still think that it's connected because of the
Yes.
lack of family history, and you're still young.
The lack of family history, and I don't engage in any of the risky activities that lead to it. I don't have that. There's just so when I take the test, it was showing that I had a fairly low risk. I mean, even relative to the normal population, I was considered low risk.
Mhm. So, knowing that your service is connected to your cancer, did it change how you feel about having served?
No, I don't have any regrets. I when you sign up for service, you understand that you may die, very frankly.
Mhm.
And I have colleagues who did, and much younger while we were at war. Carrying Gasowitz, for example, died at age 28, being blown up by a VPID. So even if let's say that I had gotten unlucky and had a much worse case of cancer and passed away from it, at least I would have had 20 years after that they didn't get to have. But moreover, I would say that I've benefited a lot from my military service. I use the GI Bill to pay for my undergrad, my master's degree. I was able to, move from a tiny town in Iowa, from a, kind of impoverished family into having a great life. And I truly believe that I wouldn't have done that without my service. So I'm nothing but grateful.
That's incredible. It's an incredible testament both to the service and to you. So, you see this poster. The difference between an ordeal and an adventure is positive attitude, and you find out you have cancer. How did you transform the ordeal?
Kind of felt like God put that poster in front of me at that moment.
Okay.
Does that make sense? I was looking at it, and I was like, it was catching my attention and just catching my attention. I was a little annoyed by it, about the audacity of putting up like this kind of cliche twee poster. in a setting like people finding out if they were gonna get cancer. And then I kind of checked myself and said, um, the people who work here know a lot more about cancer than you do, Laura. So, maybe there's something to this. And I was just stewing over it. And then I said, you know what? They put this up for us. They put this up for us. So I'm going to do it. I'm going to do exactly what they say. If this comes back and it is cancer, and I kind of on a gut level thought it would be, if this comes back and it is cancer, that's how I'm going to approach it. I'm going to have a good attitude. I'm going to make sure that it's as positive an experience for me and everybody around me as possible. And that was so great. And then another one that I looked up because I didn't know anybody with cancer. So I started Googling, celebrities who've had breast cancer. And I saw this one by Hoda Kotb, and she said, life will be different after cancer, it will be so much better. And I was like, that's going to be me. I'm going to have a better life after cancer. And it ended up being exactly what happened. I'm about a year and a half out. I've so many great things have happened to me, and I think it's a result of me having cancer, contending with, am I really living the way that I want to live? Am I working in the job that I want to work in? How are my relationships? And I just started making changes, and my life is drastically better. So I think, it started with whoever put up that cliche poster was very wise. And anybody that takes the advice is very wise too.
Yeah, I often talk about my cancer year was one of the happiest years of my life. I've never felt so loved, so supported, so held, or
Hmm.
so powerful, right? Like you're doing
Yes.
something hard. I have to ask, did you keep running through treatment? I mean, obviously you can't run when you've got the drains, but
Yeah, I did. So I've had a number of revisions. I actually have another revision in 4 days. So I've had multiple surgeries. Um, and the first time that when I had the double mastectomy, at first it was so hard to even walk. It was hard to even walk. But I started walking, and then I think I got to around week 5 or 6, and I confessed to my doctor that I had been walking 7 to 10 miles a day. And would he be violently opposed to me trying to gently run? And I showed him like I was doing a strength class
mm,
it's free on the internet. It's this double mastectomy class, like for people who are recovering from it. So if you Google like workout for mastectomy, you can find it. But I did that, and I think he kind of noted that I was approaching this in a gentle way. And so he told me that when I was ready, when I felt ready, that I could do it. So in subsequent surgeries, he's been less strict with the restrictions on walking and things like that. So I've been able to walk and then eventually run. It does take a while, though. It takes a while to go from walking to running, but I did it each time.
yeah, I wasn't allowed. I lift and I ride. I don't run. I was 6 weeks, nothing, but walking. I was actually encouraged to walk, and they wouldn't let me out of the
Yeah.
hospital until I was walking. And
Yes.
I wanted to get out pretty fast, so I was walking the first day. Like, let's go. But I think the lifting, the running, the cycling, all
Hmm.
actually made recovery faster. Like my body was used to having to
Yeah.
recover. Um, and, I mean, when I wakeboarded 3 months after my surgery, with the doctor's permission, I was like, wow, I did notice that. I can feel that in my abs. Well, the only answer is I have to
Yes.
wakeboard more.
Yes. Yeah. Yeah. I mean, I think part of recovering from these surgeries is rehabbing and getting back to whatever activities that
Right.
that you enjoy. But yeah, definitely the exercise helps.
Yeah, no, it's great, and I'm sure you were running right up until the surgery, and I do
Mhm.
hope that your revision is easy and successful and hopefully final,
Yes,
because,
it will be, I hope.
surgery is no fun.
So I knew that the way that I told them about cancer and the things that I said about it would affect how they would experience, the it would affect their entire experience of me having cancer, and it would impact their optimism, and the extent to which they were afraid. So I took a couple days and rehearsed just to myself.
Mhm.
I read, articles in the internet about the right way to do it and what to say. So, the day came. We told them that we needed to have a family meeting about a vacation that was coming up because I didn't want them stressed out. Like, what is this family meeting? And so I told them, they sat down in it. So I said, I do have cancer, but it's early stage and I'm not going to die from this.
Mhm.
And my son kind of sat back, eyes open, kind of processing it. He's younger. My daughter was upset, and we hugged and we worked through it. And I made sure that I was coming across very calm. I think that your temperament is contagious, and if I was calm, then they would be calm. And within like an hour or something, I mean, it sounds terrible, but we were kind of cracking jokes about it, because I would say
Why
like,
not?
um, yeah, I would say, I think it was like, what are we having for dinner? And I was like, well, I get to choose because I have cancer. And so, and that was really like how we approached it in the beginning was, it's a tense thing and humor breaks it up.
Mhm.
And so, all of us had permission we didn't say we all had permission, but everybody was like safe to crack jokes about it. And I think that helped.
Did you encourage them to do anything themselves? Like tell friends, tell teachers, talk to a clergy or a doctor or anything like that?
I did, so before we told them, we took them to, Inside Out, happened to be in theaters, Inside Out 2. And so we took them to Inside Out, which is a movie about feelings, expressing your feelings
Mhm.
and things like that. So we did that we knew, um, I told them basically however you feel about this is fine. Right, if you want however you wanna talk to people about it is fine. I talked to their pediatricians to see if there was, like, resources, and, there wasn't any. I asked them if they wanted to talk to, a therapist, they weren't really interested in that,
Mhm.
and I respected that. Now, my son did go to one of his teachers every morning and report my progress. And I think that's so sweet. She would hug him. If I had like a surgery coming up, she would hug him. And my daughter's counselor at school was just absolutely fantastic. If I was, I would say like, hey, I'm going in for something. Ellie may be upset today, or she may be, not as focused. And so that counselor would communicate with her teachers. And I think that helped. I mean, it was a tough year for the
Mm.
kids. Me declaring that I wasn't going to die from it doesn't necessarily like remove all of
Right.
their concerns. But yeah, they got through it with a lot of community support.
That's great. I like it that the community shows up. I told my kids that since I was a kid when my mother was diagnosed, I said, anything you feel, you feel. It's okay to worry about what this means for you. That's not a strange reaction. That's normal. So don't feel guilty about it. And
Right.
I would suggest tell everyone. And you can choose not to do that. And, two of mine told everyone and one of them did not. And I said, you don't know where support will come from. People don't walk around with a badge that says, I have lived through this shit, right? They keep it,
Exactly.
right? Like, and,
Yeah.
you don't wear the veteran's hat. We don't wear the cancer veteran's badge, right? Like, it's not
Right.
obvious. And so when you tell people, some people will be awkward and some people will give you a hug and some people will actually say, I've been there. And those people are going to be life rings.
Yes, exactly. Yeah, I agree about telling people. For some reason, I think people sometimes think isolation will help them deal with it, or they don't want to be a burden to others. But I think, a friend's someone that lets you help, right? And people want to help. They care about you and they care about your well-being. So that was my approach.
And if you let people in, people can help in small amounts. So you're not a burden. If you rely only on one person, say your partner or, what have you, that's a huge burden. And, yes, we'll
Exactly.
carry the load for each other, but it's really easier if we spread it out a bit. And I was amazed. I was amazed at the number of people that showed up for my sister back when she went through it. I was so blown away by the people who showed up for me and my family. I think that's one of the gifts that comes from a crisis.
100%. People don't walk up to you on a normal day and say, "Listen, you mean a lot to me. I hope that things are going well for you." But when you have cancer, people say that to you all the time.
Which is
So
nice. Like,
that
we
that
should
is
say
kind of a
it.
lovely.
We should say it more often to people. Like, you
Exactly.
matter. I love you. You're great.
Exactly. Yes.
Why are you saying it?
Yes.
Because you're in
Yeah.
front of me. I'm saying it because I see you. So,
Yes, exactly. That was a takeaway for me was, I don't know why we wait to say these things. We really don't know. It's all random. You could get hit by a car, and so I'm a lot more intentional about telling people I appreciate them now.
me too. I think it's very important. I think it makes, at least for me, I feel good when I tell somebody how important they are to me. And I know it makes them feel good.
Yes, exactly.
So, I want to go into my lightning round. There are 5 questions. I just want you to blurt out whatever comes to your mind.
Okay.
All right. Complete the sentence. Every female veteran should know.
They are appreciated.
What's the biggest myth about military related health issues that you want to bust?
I would say the biggest myth is that the VA is only for people who can't afford private medical insurance. I think every veteran should probably be walking through their doors at least once a year, in order to kind of touch base with them about their risks and any sort of screening that they may need to have.
Fantastic. If you could change one thing about how the VA handles veteran cancer cases, what would it be?
I think they need better PR. Right? Because I think one of the things that holds veterans back is that they do get a lot of bad press. That's one of the things that held me back is that I read about, these people, these soldiers or veterans are dying in the waiting rooms waiting for treatment, and certainly paints a really bad picture that is not, at least currently, it's not accurate according to what I have experienced. And I think if more people knew that, they may be engaging the services.
Yeah, it's a phenomenal resource and well deserved. We should treat our veterans well. Um, so, for healthcare providers who are listening, what's one question they should be asking every female patient who about military service?
You should be asking what kind of environmental hazards they were exposed to. I was exposed to toxic burn pits, but that's one of many hazards that people are exposed to. Even if somebody just has an office job, in many cases, you're working in a condemned building with asbestos and, just lots of things that cause health conditions. So they should be asking about that, about their exposure to jet fuel, just the various things that are pretty routine in military life.
Yeah, that non veterans have no idea about.
Right.
All right. What's your advice for someone looking to kick cancer's ass?
Do it boldly. I feel like some people hesitate, how's it going to turn out? What is this test going to say? And naturally, you're going to worry about that, but you have to decide what your approach and your attitude to it is going to be. Like you know, the tactical decisions are what they are, but you own the strategy.
Absolutely. And you can even shift some of the tactical decisions if you need to.
Mhm.
I traveled during chemotherapy and my doctors worked with me. I had immunotherapy for a year and I traveled and they worked with me. It's a partnership and I like it. Do it
It it
boldly.
it certainly is.
Yeah.
Yes.
Do it boldly. And look at you. You're a year and a half out and you said your life is fabulous.
Yes. Yeah. I wouldn't wish cancer on anybody, but if they have to, I would wish that it would be the way that it's happened with me, where it was a mild case, and then mild case of cancer is still terrible, right? But then also it led to a lot of reflection, and I think when I first got cancer, people said things to me like, this is going to open up all kinds of insights that you wouldn't otherwise have, and people were very positive towards me. So, I would encourage people to spread that kind of message because it did change not only how I endured cancer, but then also how my life ended up being after, which is just wonderful.
It's really incredible. I think I've talked to hundreds, maybe thousands of people who have faced cancer. First off, they often say, I wasn't sick, right? I was healthy. I just had a lump
Right.
or a scan. I didn't feel sick. But second, they say the same thing you said. I would not wish this on anyone. I did not want this. And my life is better because of it.
Yes.
Even the ones for whom, they're going to deal with it for the rest of their lives, right? They're just iterating treatments. It's amazing to hear all of us. It's like the sorority no one wants to join, but the members are pretty great.
Yes, exactly, exactly, and, when you choose to make your life better, it's not happenstance that it happens that way. That's an individual act of will to just decide to overcome it and to make it be a force for good in your life.
Right, that's a choice. That's a
Mhm.
choice. And, you know, you can't choose whether or not you get cancer. You can choose how you're going to face it and deal with it. And is it going to be a catalyst in your life? Is it a speed bump? Is it history? Like, what do you want it to be? So, Laura, I really appreciate you sharing your story, your experience. I do appreciate your service. I'm glad to hear that it was such a powerful catalyst in your life. But more importantly, thank you for all that you've done for our country.
Thank you so much.